Thank you for that answer. I've been involved heavily and very concerned about juvenile justice for a long time. Mm-hmm. And right after I was elected to the New York State Assembly in 1999, in my district in Salamanca, we had a terrible case. 39-year-old Penny Brown went jogging on Mother's Day on a trail. So it was in the middle of the day in Salamanca with her 2 dogs, and she never came home. She had been strangled with her dog's leash and raped. So she was raped and murdered by a 15-year-old by the name of Edward Kent. Edward Kent had previous violent offenses and was supposed to be under the supervision of the Office of Children and Family Services. Obviously, the ball was dropped somewhere, and as a result, we pushed very hard to pass Penny's Law successfully, which actually increased the determinate sentencing of youth who commit second-degree murder. Mm-hmm. So under the governor's current proposal regarding raise the age of criminal responsibility, as I said, for 16 and 17-year-olds would be raised. And there's a system that would be created called youth parts within a superior court in each county to exercise criminal jurisdiction. It's a change from what the governor proposed last year, but I still have concerns because the result could be that people who commit violent crimes could end up going to family court and actually have a decriminalization and a big reduction in a penalty. And I just want to read some of the offenses that would be included under this proposal. First-degree murder, second-degree murder, first-degree kidnapping, first-degree arson, first-degree assault, first-degree manslaughter, first-degree rape, first-degree criminal sexual act, first-degree aggravated sexual abuse, second-degree kidnapping, but only where the abduction involved the threat or use of deadly physical force, second-degree arson, first-degree robbery, attempt to commit first or second-degree murder, attempt to commit first-degree kidnapping, such conduct committed as a sexually motivated felony, first-degree burglary, second-degree robbery, second-degree criminal possession of a weapon where such is possessed on school grounds, such conduct committed as a sexually motivated felony, second-degree assault, second-degree robbery, criminally negligent homicide, aggravated criminally negligent homicide, second-degree manslaughter, second-degree aggravated manslaughter, first-degree aggravated manslaughter, first-degree course of sexual conduct against a child, predatory sexual assault, operating as a major trafficker, first-degree criminal possession of a chemical weapon or biological weapon, first-degree criminal use of a chemical weapon or biological weapon. Such conduct committed as a sexually motivated felony, specified offense when committed as an act of terrorism, any felony level act of terrorism. So that's the list. Mm-hmm. And I understand that the governor has changed his proposal so that it would go to the youth parts in the Superior Court, as I said, but there would still be the opportunity, and I understand that it's with a district attorney signing off, but still the opportunity for these very serious violent crimes to actually be reduced in family court and basically decriminalized. So I just want to point that out to you because I think that that is something that many members of the legislature are concerned about, and public safety is one of our most basic responsibilities as elected officials. So I didn't know if you wanted to comment on.
Yeah, no, so, and I think what you just recited, Senator, I think is in recognition that I think the governor and the administration too wants to be certain that as we raise the age that it's done so safely, that community safety is not compromised, and that young people who need to be held accountable are held accountable, but also at the same time are given an opportunity, given the fact that they are juveniles and all the research points to the need for treatment and rehabilitation. If it's any small comfort to you, I believe that when we look at the number of young people, the 16 and 17-year-olds who have been coming to the attention of the criminal court system, the JO offenses, that the vast majority, and I want to say it's about as high as 92%, but I don't quote me on that, but nonetheless a very high percentage of those 16 and 17-year-olds who have been coming to the attention of the system are for nonviolent offenses, the top offenses being burglary, robbery, and some level of assault. But again, Senator, as we continue to deliberate the Raise the Age proposal, I think any additional information about the types of youth we could certainly share with you, and certainly I think we recognize, based upon the proposal last year, there was a concern about a presumptive transfer down to family court, which, as you point out, is not part of this proposal, and that it is upon the consent of the DA or a grand jury, and so that that control is really left in the criminal court system.
Okay, thank you. I still have some deep concerns about this proposal, but at this point I'll defer to the Assembly and come back for some more questioning.
Assemblyman Oaks.
Thank you, Commissioner. In the state, the Child Care Development Block Grant requires a responsibility on child care providers to do more inspections of those. And I see in the budget that there is $10 million additional for that. With the requirements of that oversight and the inspections, do you think that $10 million is going to sufficiently cover all that has to be done?
I think it's a question that your colleagues have raised. I think it's an initial investment, Assemblyman, that we could begin to, we already increased inspections, as I think you heard me say, absent additional funding. Last year, OCFS increased its inspection visits by about 15% to child care providers. So again, I think we want to continue those efforts. I think the $10 million will get us started, on our way. Again, the other part of the federal act that is a new element for us is that these inspections also require the legally exempt community. So that's another significant group of providers that we will have to plan for and address.
Are these all going to be done by the state, or are some of those going to be responsibilities, the inspections of the counties?
Yeah. So I think the majority will be done by the state, but we do have some CCR&Rs who may provide some inspection visits on behalf of us, particularly in a legally exempt care. So again, I think it'll be a mix.
Thank you. The other question I had was just related to after-school programs, and I know that we have a lot of programs run in schools that are funded perhaps from other sources and whatever. Brought to my attention that, for instance, qualifying people to work in those programs, we have some staff who may work at the school during the day and also work at the after-school programs, but needing to be separately qualified to do that. Have we looked at trying to do in this program and others more synergy between and cooperation between the different state agencies? So if we've qualified somebody here, it would seem to me that we ought to be able to do that for the others.
Yeah, I think that's a very similar theme to what I think it was Assemblywoman Lepardo raised earlier. And so I think, again, as we contemplate how to incorporate the elements of the federal act, I think we'll be looking at how can we, now that we're going to be doing or needing to comply with additional clearances, how do we do so in a more efficient and less duplicative way?
Thank you.
Thank you.
Thank you. Our next speaker is Senator Savino.
Thank you, Senator Young. I'm back for round two. First, for clarification, I just want to make the point that when we discussed earlier the fact that the City of New York wanted to be carved out of that statewide program for posting your most recent child care inspection report, it was the previous administration, not the current administration. But I want to turn to an issue that we started working on a few years ago, and that was close to home. So if you can give me briefly the implementation of limited secure and whether or not we moved to secure detention at all in that program.
Sure, happy to. So as you recall, legislation was passed, I think, in 2012, calling for close to home, which just to recall everyone's memory, allowed New York City to reclaim its young people who were adjudicated needing non-secure level of care. That was called Phase 1, and then Phase 2 was for youth needing limited secure care. So after a lot of planning and work on the part of New York City and OCFS, in 2013, Phase 1, which effectuated the transfer of 238 youth from New York City out of state facilities back to the city, was completed. So New York City created capacity within their service delivery system, and then also had to create an aftercare component, so that's the post-release supervision requirement of those young people leaving care. So that was ended. And then just recently, at the end of 2015, I think, frankly, and I know if Commissioner Carrion were here, she would say the same thing. New York City really wanted to be very thoughtful and to slow down the planning before doing the limited secure phase. Doing close to home, non-secure was, as expected in many respects, a learning lesson. New population of youth, providers learning new skills and techniques, and so I think we very much supported them taking the second phase very slow, which they did. So in December of 2015, just 2 months ago, with the state's approval, the city launched Phase 2 of limited secure, and so they have, again, a very small uptake of youth. I think they have about 6 young people who are living in the limited secure programs right now.
Okay, thank you. I want to turn to child welfare and child protective services. We are in the grip of a statewide epidemic with respect to opioid abuse and heroin abuse. And as you know, Commissioner, 25 years ago I started as a caseworker in the child welfare system. Then the drug that was, ravaging communities was crack. The default reaction from Child Protective Services then was any child that was born with a positive toxicity to drugs or alcohol was immediately remanded into foster care, and oftentimes the siblings were as well. We no longer do that, but I'm curious as to what the effect of the opioid abuse crisis and the number of positive tox babies is having on the Child Protective Services system and the child welfare system.
It's a very good question. So we obviously have been, watching this very closely in the past couple of years. We know that looking at our data, approximately 19 counties are seeing some increase into foster care, again, the trajectory of foster care in New York State has been downward. We've had about a 64% decrease in the number of children in care in the past 20 years. And so we started to see a small uptick, and it attributed, to removals due to the opioid heroin crisis, particularly in upstate smaller jurisdictions. And so, we've been working very closely with Oasis, who I know when you heard, their testimony, they're doing a lot to try and increase access to treatment services, which is always a challenge. We've also been working with some counties that border the state of Vermont. We saw a lot of those counties being particularly impacted. And so we've joined a collaborative with some of those counties upstate. So again, and as to your question of babies born positive tox, I don't have, that data. We probably could, look to the health department to provide that. But, make no mistake, it's having an impact, certainly in some counties where some removals are on the increase.
But you should have some sense, because a positive tox birth should trigger a call to the state central registry, if for no other reason than to come in and figure out what's happening with that family before you release an infant home to a mother who is obviously dealing with addiction issues. So there should be some way for you all to understand how many infants are born in the state positive tox, how many families are receiving either preventive or protective services, how many court-ordered supervision cases. And the reason I bring this up is because I believe that we're going to start to see foster care placements rise again. And they may never reach the level that they did in the early 1990s, because we treat these cases differently now. We don't automatically take every child and put them into foster care. But there's no doubt that we're going to have to do a better job of coordinating services between Child Protective Services and maybe more coordinated supervision, if not foster care. So I would just hope that you and the local social service agencies, take a better look at this and figure out how widespread this problem is and what we can do to preserve families and keep them together. Thank you.
Thank you, Senator.
Thank you, Senator. Assemblyman?
That's it.
Senator Kennedy.
Thank you again, Commissioner. I want to talk a little bit about Healthy Families in New York. In your experience, can you talk about how the relationship between OCFS and Healthy Families New York can work to proactively attack this scourge of abuse that's happening in our communities?
So we're very proud that's our program, Healthy Families New York. So we are able to, we have set 37 programs, Senator, across the state. It is a nationally recognized evidence-based model, with really good returns on investment for the state. And so these are for very young families with newborn children, home visiting model going in, teaching parents safe sleeping, whole sorts of child development skills that have very good outcomes in terms of readiness of these children being ready for pre-K and kindergarten, reading outcomes. We have a whole list of, of great outcomes. And as I said earlier, we're serving right now about 6,000 children in the state. So it's a program we're very proud of.
Do you believe that, well, let me ask you this. What percentage of eligible mothers are actually enrolled in the program? Do you know that percentage?
I don't know the percentage,
Okay.
Senator.
Do you know if all eligible mothers are enrolled, or is there a
No,
gap?
I think it's fair to say that there would be more opportunity to serve more families.
So, and do we have a cost on that?
I don't know what it would take to take it to statewide scale, and as Senator Squadron pointed out, there are other valuable models of home visiting as well. But I don't know to your precise question, the exact unmet need.
Can you talk about the relationship between the enrollment and prevention services and its impact on child abuse statistically?
So, I think the impact is the evidence that we see that this model of intervention with families, and their children does show that those families who fully participate in the program, and again, this is a program that is on average a 5-year investment, so we stay with families, for quite a bit of time, has shown reductions in further reports to the State Central Register. So presumably that would show that there are families who have greater capacity to care for their children. So I think to your question about as a prevention strategy, I think the answer is unquestionably yes, it is.
A prevention strategy that needs to be funded appropriately. The home visiting programs that you had mentioned, can you talk about how those home visiting programs relate to child fatalities? What would be the cost savings associated with universal coverage?
Well, as I said earlier, Senator, I don't have the data about what would the universal coverage mean in terms of number, or cost. And again, none of our evidence points, a correlation that this has prevented child fatalities. We don't know that, but again, as I said, what we do know from the evidence of our program is that it does in fact prevent additional calls to the State Central Register, which is an important indicator that families are not coming to the attention of the child welfare system again.
Okay, I just want to go back to what I had asked you earlier, and I'll be very brief because it's been burning me since I first asked it. And you had said that you didn't have the numbers and you didn't know what would preclude New York State from allowing Erie County to move forward with the WDI facilitated enrollment program. I think, look at. there should be a level playing field across the state as it pertains to these services. I think we can all agree on that. And from a needs-based perspective, Erie County is certainly teed up to be in dire need of that facilitated enrollment program for childcare at the 275% level that WDI facilitates. So I would just like to get your thoughts on how we can implement this in Erie County, because the folks that I represent desperately need this, but in every county across the state, so that there's not this mishmash across the state of counties that have this program and counties that don't. There should be an equitable playing field. And I'd like to hear your thoughts on that, and what we can do working together to make this happen.
So, I can commit, as I did earlier, Senator, to going back and looking at, the current facilitated enrollment initiative. As to your larger question, statewide-ness of these initiatives, I think it's something that we always aspire to, given our resources and other priorities. But again, the issue of childcare has really been the #1 topic here, at the hearing this morning. So again, I'll take that into consideration as we continue these conversations around childcare and access for other individuals across the state.
Great, and I'll just leave you with this, just to reiterate that the city that I represent, Buffalo, New York, while we have come a long way and we're working to pull ourselves out of poverty, there's still an enormous percentage of children that are living in poverty and the working poor that need that service. It is a desperate opportunity that folks would take advantage of.
Thank you, Senator.
Thank you, Senator Montgomery.
Thank you, Madam Chair. Good morning. Good afternoon, Commissioner. I just want to ask you a question regarding the close to home and the raise the age. You have certainly indicated in your testimony, and I'm happy to see that, the governor has already done his executive order to remove young people from adult facilities. But I'd just like to ask if you have, where you are in OCFS, as it relates to funding for the evidence-based early intervention programs that are clearly known and have been successful in disrupting violent behavior and keeping young people out of the system altogether. So I would like to know what kinds of programs you now fund that do restorative justice or the alternative to incarceration programs for young people, programs that combine employment and other aspects that young people need in order to help them change their lives and go in a different directions. And there are two programs that I specifically know about and are very close to. One of them is Youth Build, which does work with young people in these categories, and also youth courts. But I'm sure there are a number of others that I'm not aware of necessarily, but are found to be part of the system where we invest in young people at an early enough point so that we don't have to pay for the back end when they're incarcerated or they're in the system in one way or another.
Yes. I'm happy to. And, Senator, I can't take credit that all of these programs reside within OCFS. We certainly support some through our rich state reimbursement. As you know, the state continues to pay counties 62 cents on the dollar for their investment in prevention programs like the ones that you just mentioned. So that's our biggest pot of money to support prevention. But also DCJS, the Department of Criminal Justice Services, through local probation departments, also fund an array of alternatives to detention, youth restorative justice practices. So I think at the local level through the regional youth justice teams, there are a lot of, if they're not evidence-based, effective programs that have done exactly what you would have hoped they would have done. And I think that's evidenced by our overall state juvenile justice profile. The truth is the number of young people who are being brought to the front door of probation for referral, for PINs, is down dramatically. It's not just upstate, it's also in New York City. But I think, in fact, the story is they're not penetrating further into the system because probation, local departments of social services, youth bureaus, other important players at the local level, all of our not-for-profits have really done a tremendous job in the past year trying to engage these young people so that they're not penetrating into our placement and juvenile justice system. Also, the Department of Labor, you mentioned employment, the Urban Youth Jobs Program, I think really understanding that for many of our young people in the system, they've been educationally disadvantaged, right, for a number of reasons, and so they lose hope of a college degree, although I want to just put a plug in that in our own secure facilities, we actually have a number of partnerships with colleges. We've had a number of youth in our secure facilities actually obtain their associate's degree and so forth. So again, I think there's wide recognition, and the governor's been focused on reentry and removing some of those barriers to adults as well as young people really being successful citizens in the community. So I think that's a good story for New York State, Senator.
Yes, I certainly would like to hear more of that from you, if at all possible. And I recognize that in order to be successful with Raise the Age, we will need in communities some infrastructure which helps us to be able to deal with young people very differently from just appearing at your door with the PINS petition. So
absolutely. And so just to that point, Senator, in the state fiscal plan, 17, the out years, there's $155 million, in the out year state plan to support all those kinds of local efforts to build capacity to serve those young people. So I think the governor has extended his commitment to support that development.
I appreciate that.
Thank you, Senator.
Thank you. Senator Squadron.
Thank you very much, and thank you for the opportunity to come back. Just briefly, in answer to Senator Montgomery's question, Nurse-Family Partnership has a 50% reduction in participation in the criminal justice system at 15 years of age, exactly the Raise the Age category we're talking about for both kids and parents. So you talk about diversion and prevention. Nurse-Family Partnership is an extraordinary program. I was disappointed you didn't raise that. Also, Senator Kennedy asked about savings from reduced child protective services or abuse and neglect claims if healthy families were expanded. Your answer was that you didn't know the cost of expansion, but he was asking about savings. Do we know how much claims of abuse and neglect could be reduced if healthy families or Nurse-Family Partnership were expanded?
We have not done that analysis that I'm aware of, Senator.
The public analysis of healthy families in New York is a 49% reduction in cases of confirmed CPS between child protective services between 5th and 7th years. 49% reduction in the rate of confirmed child protective services claims between years 5 and 7. Nurse-Family Partnership is 48% over 15 years. So there is an answer to that question that we know. And just to be clear, reductions in child protective services claims protect children, save lives and families, but they also save money, right?
Yes.
About how much?
That's
what's the average
question.
What's the average cost of each claim?
I don't have the answer.
We don't know how much it costs every time a family gets involved in the CPS system.
No, we don't. I
On
don't
average.
have that information.
Is it possible to try to get that to us?
Certainly work on that.
Thank you. But we know whatever that cost is, it's that divided by 2 if we expand Healthy Families and Nurse-Family Partnership.
Understood. Thank you.
Thank you.
Thank you, Senator. Just a couple quick questions before we close. Senator Savino asked about the Close to Home program. And as you know, phase 1 involved the transfer of the custody for young people in non-secure placements from OCFS to New York City. However, there was a March 2014 report that showed that was done by your agency, that showed that there were more than 1,100 escapes by youth during the program's first year. So I was wondering what specific actions have been taken to address this problem.
Yes, certainly. So the report you're referring to was, of course, published in early 2014. I think it's very fair to say that in the early implementation phases of the non-secure, that there was an adjustment. As I described earlier, the escapes were, in fact, AWOLs. The majority of which young people, they were now in more neighborhood settings, closer to their families. They are not in lockdown facilities. There were a lot of kids exiting those programs, but the vast majority returned within an hour or two. So just to kind of put that into some context, we provide very rigorous oversight from the state level of the Close to Home initiative. We created a special Close to Home oversight team who works very closely with ACS in monitoring programs' performance during the initial implementation of the non-secure portion of Close to Home. When it became evident, Senator, that some of the providers just weren't up to getting the job done, New York City took appropriate action in putting those agencies on heightened monitoring, trying to provide additional technical assistance to support them in stabilizing the program. And in instances where that was not successful, the city, with urging from the state, took appropriate oversight to actually exit the contract for that provider. And so they had a challenging beginning, but I am pleased to report that on the non-secure portion, they've actually made tremendous progress in reducing the AWOLs for those programs. They're getting some really good educational outcomes for the young people in the non-secure programs.
Have you looked at 2015 statistics? Do you know what those are?
I'm sorry, Senator?
Have you looked at 2015 statistics? Do you know what those are as far as escapes?